Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Fickus, say hi.
Star 6.
Commissioner Fickus. Go ahead.
Okay. J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by our own Tilly Bergen from Arlington. We sure appreciate her being here. She's the Executive Director of Mission Arlington. Thank you so much for being out here today.
Let's pray together. Father, we gather together right now to honor you most of all, and thanking you for the way that you have brought some people together to give leadership, and the way that they have followed your lead, Father, for the will of the people. And Lord, we want to thank you for every one of them as they stand behind these desks and make decisions with a heart that's yours, so that all people can be safe, can be cared for. And I thank you, Father, for the way that it's evident that they are always looking for ways to give, to serve, and they're just a tremendous role model for all of us. And so I thank you for them, every one of them. And so for the country and the crisis that we are going through, we certainly pray, Father, for you to eradicate the virus, and we can ask because you said to. And we give you thanks and praise in Jesus' name. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you.
Thank you, Tilly. Mr. Mangus, agenda announcements.
Your Honor, just to continue in the same format that we had last week, as relates to the agenda, we're going to be moving up the briefing item to the first part so that we can encapsulate the coronavirus discussions all in one particular area of the agenda. So as we move to our section, we'll begin that process.
Okay. So members, you have before you the minutes of our regular meeting of May the 5th.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Allen. Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
He's here. Motion passes unanimously. We have a couple of proclamations that we've got for ratification only. The first is for the National Day of Prayer. I would move its approval.
Second.
We have a motion and a second. Please vote. Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Motion passes unanimously. Our next proclamation for ratification only is proclamation for the Mental Health Awareness Month. I move its approval.
Second.
We have a motion and a second. Please vote. Commissioner Fickus.
Yes.
Commissioner Johnson.
Yes.
Motion passes unanimously. Court members, wait a minute. Commissioner Allen has an announcement.
Yes. Wanted to be sure to share with you all that on Thursday, this Thursday, May 14th, we are hosting a senior citizens teletown hall. We will receive updates and resource information from 60 and Better, Meals on Wheels of Tarrant County, AARP, and the Area Agency on Aging. It's, again, this Thursday, May 14th, from 11 a.m. to 12 noon, and you can follow our Facebook page and receive our emails or get with a member of our team to get the call-in information. Thank you.
Thank you. Court members, you now have for you the consent agenda.
Move approval.
Second?
Got a motion and a second. Please vote. Motion passes. Well, not yet. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Now it passes unanimously. Mr. Manius?
So, Your Honor, the first thing we're going to do, we're going to go ahead and ask Dr. Tanasia to come up and make his presentation.
Good morning, Your Honor, and members of the court. We're going to go over our briefing for COVID-19. So just to present numbers for this morning for Tarrant County, I believe we have 3,812. Let me double check. And that was an addition of about 67 new cases that we'll be reporting today. Total deaths reported for Tarrant County are 109. That's 5 new deaths added to our total. And recoveries are going to be reported at 809. Of significance to note, as you all have heard about institutional outbreaks occurring over the last few weeks, now about 37% of our outbreaks are, or numbers are, coming from various facilities. Not all of them are nursing homes or long-term care facilities. It's about half and half. But we're seeing a couple of large outbreaks in other facilities, such as the Federal Medical Center that you all have heard of recently. But we'll get into a little bit of details of that. I want to go over some testing efforts that we're doing in the county as well. We launched a website called covidtesting.tarrantcounty.com on April 26th. And since then, we've had, and this data was good of last night, about 4,500 people utilized the website to do self-screening, and about 1,900 or so got an appointment, for one of our testing locations. So far, we have 3 testing locations up and running. And as you can see on the right, there has been some good traffic to the website itself. There have been about 65,000 page views and about 13,500 or so unique visitors. And I did take a quick look. DSHS did also unveil that Texas Health Trace, thing that they've been talking about the website, and it's a multi-part deal. Their first part was actually released on April 27th, very similar to ours. It's a self-screening tool, and they have had about 7,500 or so screened. That was yesterday afternoon. I'm sure there's been more. So we're not doing too badly on the numbers. Although I will point out that the trend at the bottom of appointments being given is sort of trending downwards. And that's concerning to us because we want to make sure that the public does utilize the testing capacity that we now have in our county. We have 3 locations running with about 425 tests a day available, and we're not filling those appointments. So if there are people out there that are needing to get a test, certainly they can come to our website at covidtesting.tarrantcounty.com and get qualified to get a test. And if there is a concern about how it's going to all get paid, it's no cost to the participant. What that means is if you're uninsured, obviously there's no charge for that. But if you're insured, we will take your insurance information and pass it on to the lab company. But under the CARES Act, all the co-pays and deductibles are waived, so there's no out-of-pocket cost to the participant. It's just to stretch our dollars, so to speak. If there's a third party responsible, we will let the lab company bill those, and the rest will be taken care of by the CARES Act.
Vinny.
Yes, sir.
You sensed that I wanted to talk to you this morning.
Yes, sir.
I think we are at the point where we need to consider different criteria for approving people to be tested. We're in the phase of trying to reopen the economy and send people back to work. there are a lot of people out there like me who don't feel real comfortable about that without having access to a test. Now, according to our current criteria, you've got to have some symptoms in order to get an appointment to be tested. I submit to you it's time to change that dynamic and start testing people so they can feel good about going back to work. What you got to say about that, Vinny?
So, Commissioner, we have already incorporated some of that in our criteria. It started off with CDC high-risk criteria that focused in on people that were, symptomatic of the illness, and also on healthcare workers and first responders. And later we added the medium risk criteria that loosened up the category, so to speak. So now what we have is that pretty much anybody who's either got symptoms or is in a high-risk occupation, regardless of whether they are symptomatic or not, or if they're a contact to a known case, regardless of whether they're symptomatic or not, are allowed to get testing through our website. So
how do you define a high-risk occupation?
So far in our risk category, it's defined as healthcare worker or essential, critical function worker like a government employee or first responder, fire, police, EMS. That's the standard definition. We haven't yet expanded to other categories. There's been a lot of debate about essential businesses. We haven't yet opened that up, but there's been discussion going on with our partners at OB on how we can accommodate that to include, let's say, people that are in congregate settings, grocery store clerks or retail workers, restaurant workers, things like that. Yes, sir.
Yes.
So we're in conversations with them. They're trying to get us a plan, hopefully by the end of the day today, to include that in our testing.
I even had a call a couple of days ago, maybe it was on Friday, from a county employee suggesting that we ought to offer testing to every county employee because we're now asking them all to show back up to work.
So I hear what you're saying. The pitfalls of that is when you test somebody, let's say we mass test all county employees.
I understand it's just a snapshot at that moment.
Yes, sir.
But there's benefit to that from a feeling of security on the part of the person tested.
But Commissioner, I'm not sure we have that many reagents.
Well,
and I'll
we
point out.
may not yet,
Well,
but we got a bunch of money.
One thing I want to point out, and this
Everybody is promising us reagents.
no, they're not. And in fact, Abbott began to lessen the number of reagents that they're sending into the area just this week.
The other Abbott said we're going to test everybody in the state of Texas.
Well, I hope he'll pay for that.
Well, and I understand that in terms of this conversation about access to reagents is that some of the resources are being redirected to the federal facilities that have outbreaks and then to
nursing homes and such as well.
exactly, yeah. So that's
yes.
correct, right?
That is correct. And one thing I did want to point out, and this is more a reassurance, that out of the 1,912 that we gave appointments to, I think we have results back to about 1,500 and some change, and only about 5.5% have tested positive. So that tells me that our criteria are loose enough that, we're seeing about 95% negative, even though they were qualified to get a test. So that part, I'm a little worried when you open it up to the entire group. I mean, pretty much anybody can then go onto the website and get an appointment. Okay, that's one way, but it's very hard to keep. I mean, we have a county of 2 million. We would have to keep testing people on a regular basis, and there's just not enough resources to do that to find asymptomatic folks that might have the virus. Some of that is going to be out there. It's not a perfect system.
So you may be headed this direction, but can you speak to the qualified without appointments, and were we able to notice any trends or figure out why folks who qualified didn't show up for it?
So we did launch a survey, and it was launched last night, so we have very little data, about 70 or so responses back yet out of those. But what we were finding, the top cause, about 25-30% of the people were saying that the appointment time was not convenient. Now, there's a little bit of a rub there. I mean, the way we've set up our system is for efficiency of the operation at these locations. What they didn't want to have happen is that I book an appointment at 8 in the morning and Commissioner Brooks at 4 in the afternoon, and in between there's a huge gap, and people are sitting there in a PPE and in the heat and so forth. So the way the website works, it gives you the earliest available appointments. That way all appointments are booked out in back to back, and then if there's going to be a drop off in appointments, then that rest of the hour, rest of the afternoon can be given off to the volunteers and staff that are working on those locations. But the pitfall of that is that the appointment choices are limited. What I think people would like to see is a whole appointment calendar, but that's very, very hard when we don't see appointments booking completely. You're going to have a lot of operational efficiency gaps. Then you're going to have people just sitting around waiting for people to show up, and that's not a good way to go. And that's the top cause. Second cause was locations, and that they didn't find the location convenient enough to go, or it was too far to go. So we're trying to address that too, obviously by more locations. And there's a little bit of conversation. I don't know if we're ready for that, GK, but there's a mobile testing location coming from the state.
We'll be talking about that.
Yes, sir. So that will be discussed shortly as well. But that's part of the effort to bring testing to the people instead of people having to come to the testing locations as well.
Sure. Because I think it's important, and I know we all know this, but that we don't have comprehensive transportation options for people. Not that I'm saying that if someone thought that they were sick that they should get on a public transit option, but we have very limited options for people to come to us, which means the onus is on us to go to them.
That is, well recognized and understood, and we're trying to work on expanding that. Yes, ma'am. Okay, so just going back to what our data is showing, and before we kind of look at all that, there's just a general trend that I've noticed as people ask us questions at Public Health. There's a common tendency to zoom in and slice and dice the data and look at what the details are, and that's fine for understanding the information. But in a large-scale outbreak, what I would like for everybody to do is zoom back out and look at the big picture. And really what we need to be thinking about is, are we going up, are we going sideways, or are we going down? And that's what we really need to focus on. So from a big picture trend, we're still going up. But when you start to zoom in, there is some silver lining there on the COVID-like illness trend. You're going to notice more on the right-hand chart on the red line. It has kind of trended downwards for the last week or so. So we, on that COVID-like illness, peaked around May 1st, or I forget the date. Anyhow, but in the last week or so, we peaked there, and then it's been declining for the last 8 or 9 days. So that's a little bit of good news. But is this, guarantee that it's going to be the start of a downward trend? Well, maybe not, because we've seen that happen a couple of times on that trend line already, and then it goes back up. But the overall trend remains up. And that's what I want people to take away, that there's variations from week to week, but as long as we don't see consistent declines, currently the overall trend is still up.
Where is the data dump that we did last week from the Federal Medical Center reflected in these trend lines?
Not in this one, sir. It's right here in the case counts. And so we actually had a data dump that showed up on Saturday's data, but it appears on our charts on Sunday. But this chart here is actually takes you back by when those specimens were collected, when those tests were run, because that's a more accurate reflection on how the disease was spreading. So it's spread out over several days. But if you notice the couple of bars, one showing 224, another one showing 100 something right next to it, that was the May 29th, May 3rd, or April 29th, April 30th time frame, and that's where bulk of those cases were diagnosed. Now, the first case at the Federal Medical Center was diagnosed around April 6th, and we've been, working with them since quite a while ago. Dr. Colquitt made a visit, I think, on April 24th and 25th, gave them some recommendations and so forth. And then more testing was also done at the facility. What they've told us is that, a lot of those folks, the majority of those folks are asymptomatic, so they're generally well. But there are some folks who are, symptomatic and showing symptoms. There are people that are out in the hospital. The last I knew, there were about 27 that were hospitalized. I believe they've had 5 deaths out of that. And 18 or so were in our JPS hospital. So it's not, it's not as bad as it looks on that data, but, there are a lot of cases that are there. They're just asymptomatic and generally well. If you've understood the layout of the facility, it's very hard to socially isolate people. It's kind of an open bay setup. They've made some modifications. These were cells that didn't even have jail doors or cell doors. They were kind of in a communal compound.
I've been in that facility
Yes, sir.
many times.
So they've tried to put like a...
Just visiting?
I've been in there.
Just wanted to
many
clarify
times.
that we make sure that everybody understood that you were just visiting.
So they've tried to put some, shower curtain type doors to allow for some prevention of the virus spread and things like that. And there has been a couple of different tent type facilities set up. One is set up on one side of the building to allow for well inmates to sort of stay isolated, because the numbers actually flipped, where most of their inmates are in that they have different units. In a one particular unit, a majority of them are now positive for COVID-19. So the well people are being isolated so they don't get infected. And then they have another 50-bed temporary medical facility set up under a tent type of situation as well, that is supposed to be coming online here this week. But it is a sort of it's not a hospital, but it's bed capacity that they're adding, and they have some capability to do airborne isolation and all those type of things. Some good efforts are being made at the facility. It's just that inside the facility, it's very hard for people to stay isolated. So they're trying their best to move people around based on their testing.
So what is the infection rate among the employees of the facility?
So we offered testing to about 300 plus employees. Last week, about 91 or so came and got tested with us. And I don't have the exact numbers, but what I heard was it was, so far we haven't seen anything come back that says that anybody of those was positive out of the 91. But the data is still, coming in. It's not all tests have come back.
There was an article in the paper, I believe, that I got that article from Ms. Wilson, about the fact that in Lexington they have now got to the point where they've asked every one of their staff people and guards to be tested. And I want us to do that.
Yes, sir. We offered testing again. And
I'm not saying offered. I'm saying we want them to be tested.
Yes, sir. They're scheduling again for tomorrow. Again, same type of deal where we'll, set up shop at the Rolling Hills Park. That's behind the facility, and the employees will come there and get tested. I can't guarantee that all 300 will show up. 91 were tested through us last week. I believe about 25 or so had gotten testing through various other setups there, either private doctor or through a drive-through location. Out of those, I understand that about 5 or 6 were positive. So it's a very low positivity rate so far.
But see, you're telling me that there are all these, and this is the thing that's very confusing to me. You've got all these people that are asymptomatic, which means they're positive, but they're walking around looking like they're not. And so we've got all these staff folks that basically are they walking around and they have it and they're just carrying it back out to the community, or what's the deal?
Yes, sir.
I don't want us just to go out there and say, okay, we're open, y'all come on in. I want there to be an understanding, and that the warden has basically, and if we have to talk to the union leader, whatever we have to do, but I want to emphasize that we want the staff and we want the guards tested.
Yes, sir. And we've been talking to the union, and that's how this testing has been organized in a couple of sessions. So one being tomorrow. Hopefully the numbers are better. Last time it was about 1/3 of their staff. So to answer your question, people are in a supposed hot zone with all these asymptomatic inmates. Why not have a lot more staff test positive? And a quite simple reason seems to be that they're actually wearing their PPE from the very beginning. because when they saw the outbreak happening, they did start utilizing their PPE. That's the answer I got from the site visit yesterday. Dr. Colquitt and I had a conversation about that on what has been done, what's going well, what's not going well, and that was one of the things that she noted, that they are very strictly following PPE guidance. So hopefully that's been what's the reason why we haven't seen much positivity.
So I know you had the visit out there yesterday, and from that visit there was supposed to be a plan developed. When are we going to have the plan?
So we have meeting notes from yesterday, and we're going to have a memo, developed with an executive summary and some recommendations, and that will be shared with y'all.
Well, it's going to be, and then it's going to be shared with the people at the prison, and they're going to acknowledge that they're going to follow it.
So the meeting minutes were already discussed with them, so they were understanding what was being discussed at the meeting. One of the key findings was that none of the hospital partners present there, JPS, UNT Health Sciences, even Public Health, nobody came back with a conclusion or a recommendation that any further medical facilities are needed at this point, because they do have that 50-bed facility set up, which is ready to go operational.
I understand that,
Yes,
but I want to know what the plan is, and I want to know that somebody's making sure UNT Health Science Center is the one that's providing clinical
yes, sir.
care. So are they going to report to us on a daily basis how many tests were done, and if anybody else came back positive, how many recovered, and that the units are following the procedures that y'all recommended?
So let me help you with
Yes.
that on this, okay? So we went out yesterday. We intend to have a report complete by tomorrow with the recommendations. We also talked to, I guess, UNT and the warden out there about a daily report. And we talked with their medical person out there also. So all of the issues that you're bringing up, Judge, we have had those conversations. And our intent at the end of the day is twofold. One is to have that report ready, and second of all is to get a daily report on infections and testing.
And I guess my third point would be, I want to know when all the employees and staff have been tested. And if they say they went someplace else and got tested, just show us proof.
So, and we will try to get that information, and it's a labor issue, and we're going to push on that.
Well, it was a labor issue in Kentucky, too.
It's more than a labor issue. It's an issue that these employees are not under our control. Vinny doesn't have the authority to make those employees
Absolutely.
do anything.
Yes.
Well, but
They're under
just-
the authority of the Federal Board of Prisons.
And we have a representative that is very strongly saying that they're going to do whatever they need to do to satisfy this local community. Representative Granger has been very good at this point. They had the same issue in Lexington, and they have now agreed through that same union to get all those folks tested. And I want the same thing to occur here, and if it's not going to occur, then I'm going to at least, I think Representative Granger will be glad to get very involved. She had no problem whatsoever making that statement on Sunday, and we want the folks tested. So I
Then
want to.
she needs to get involved. We can't put all
Roy,
of this
she's
on
getting
Vinny.
involved.
It's not his.
Commissioner, we understand that. Let's just say
I'm not
this.
sure the judge understands
I
that.
beg your pardon. I was on the call, and I was very involved with that part of the process, and those folks didn't show up, and Representative Granger now knows that, and she's talked with the people at the Federal Bureau of Prisons, and I do understand what's going on out there.
So what we did,
Then cut Vinny some slack.
Well, all I've asked for is a daily report and to make sure that they understand that we want them tested.
we did reach out to the union leadership again yesterday, and the result of that was this testing that we're going to do tomorrow. Let's see how many we have tested, and then if we need to do one more sweep, we'll do that. Our goal is to get everybody tested, all the employees tested.
We
have to
would
work-
all like to see all of the employees tested, but we don't have the ability to mandate that.
That's
And
why
I'm not altogether sure that that's the case. Daily report of how many
Yes, sir.
employees got tested.
I have a call pending with Dan Wagner. He's their jail health administrator. That's the point of contact I was given yesterday by UNT Health Science Center. They said that if we don't get information on hospitalizations, they have that daily, and they're happy to share that. But the cases in the facility itself are going to have to come from Dan Wagner, who's a Bureau of Prisons health administrator. So I will reach out to him again and see how we can work that out. Our team has been working with them on a regular basis, and they know you and GK both gave us a directive yesterday, so that's already been told to staff. Do not let this up. We need to talk to them daily to get the information daily updated in our database, so we're not behind on the reporting. So they understand that, sir. Yes,
That's
sir.
all I'm asking. If you let us know if they're not reporting, because then at that point we'll talk with Representative Granger, and I think she'll start a top-down approach. Right now we're trying to work from a bottom-up
Yes, sir.
approach.
We're trying to work collaboratively. Yes, sir. That is true.
But the other side of the coin is that out of about 1,500 prisoners, about over 636 was yesterday. And that was the other thing I was going to ask you.
Right.
On Friday, we thought it was 477. On Sunday, the warden told us it was 636. I've heard 642 or so this morning.
Yes, sir. That's what we heard.
So when are we going to put the other 149, 155? When are we going to put them in our numbers?
As soon as we can get that, data input, I will, after today's court, I will call Mr. Wagner again and impress upon him how much interest there is to get this data caught up and up to date. I will make sure we do that. Yes, sir.
So I share the collective frustrations, and I think it's important to recognize the progress that has been made. I know at least for the last 2 weeks that I've asked about access to testing for the employees. So for that 300 number that you mentioned, that is just for the men's facility. So
Correct.
What about the women's facility? Which I know that is not, it's still an issue. It's less of an issue, but in terms of prevention, so hopefully we can prevent that facility from, having the same issues that the men's facility does. So will you speak to that?
Yes. So as far as our information shows, they only have had 2 cases there at the women's facility, and one has passed away at one of our hospitals. And so there's really 1 case at that facility, and so far no other reports of anything changing. There's been somewhat of a, knock on wood, stable situation there. So no further action has been taken on that side.
So then what are we doing to keep it that way?
Again, as Commissioner pointed out, it's federal jurisdiction. I mean, we're trying to collaborate with a lot of partners. I have a call scheduled with the CDC this afternoon at 4, and for exactly this reason, yesterday's meeting they were not on the call or at the table. We had U.S. Public Health Services, and those folks are assigned to the Bureau of Prisons. So when I saw that on the meeting minutes, I was like, okay, why is CDC not front and center? Because that's their jurisdiction. They need to be, talking to us on a regular basis and giving us guidance on how to work with these federal facilities. So I have a call scheduled with 3 or 4 of their people at this afternoon at 4 o'clock. So I will bring that Carswell facility up as well, saying, what are we doing there? Because it's kind of a delicate thing, right? I mean, they have jurisdiction there. We're the local entity in support. I want to make sure we don't step on any toes unnecessarily when they are working on it.
And I can appreciate that, but it's also our hospital facility that these patients will be going to.
That is correct.
That brings into the question of our capacity, which I've been really intentional about saying that our capacity is good for now, right? Not wanting to, project anything negatively, but at the same time, that can change literally any day.
That is correct.
So I think it's really important that if we can get ahead of this at the other facility, that we do that, and I know obviously that you're one of many people that's working on that.
And that is true. We were one of many. I think there were 7 different agencies involved in yesterday's meeting. It was not just Tarrant County Public Health, it was Tarrant County Emergency Management. We had JPS, the UNT Health Science Center, of course the Federal Bureau of Prisons, the Army Corps of Engineers, Texas Department of State Health Services, Texas Department of Emergency Management, and this was not including yet the federal people, so CDC was not there. The federal folks have been talking to the Office of Inspector General. A variety of other federal entities have been involved in this effort. So we're one of many players in this mix.
Sure.
One of the things that I think we also need to be pointing out as we talk about our cases every day is the available beds. You know, for the last week, we have had we've been running on average between 240, about the mid 240s as far as number of COVID-19 patients that are in the hospital. And that stayed fairly flat throughout that process. I think we got down to 199 at one point, but then it jumped back up. But at that same time, yesterday, we had 2,354 available beds open, almost 10 times the number of COVID-19 patients. And I don't want us to ever lose track, or at least I don't want us from this point forward to lose track, is the reason we put these restrictions in place was to make sure we didn't have to close down our hospitals. Now, I'll grant you that this federal prison, because of the high percentage of positive cases that they have, concerns me, but you keep, and we've both talked about the fact that a lot of these are asymptomatic.
Yes, sir.
Which it's I don't know. I can't quite understand that, given the fact that we know that about 500 of them fall into that vulnerable category. But it is what it is from that standpoint. But I don't want us to keep focusing only on the positive cases and not at the same time focusing on the available beds, because that's our goal, to keep our hospitals open and to make sure that under no circumstances do we get to the point where we have to close them. And that, to me, is the critical part and the reason why I think the governor started lessening the restrictions and why I support those lessening of the restrictions. What we've got to do is we've got to keep people from, hopefully they'll stay in tune with the fact that we still need to do, the social distancing. We still need to wear the masks. We don't need to have large gatherings.
Yes, sir. And I don't want to belabor the point because it's been covered, but there was a large gathering. I mean, you all heard the shooting situation in Fort Worth. The 600 people in a park. I mean, from a health standpoint, that was very unfortunate,
Unbelievable.
Yes, sir. So, it happens. But I just want to get back to the case trend. So I already pointed out there's a little bit of good news on the COVID-like illness. So if you look at as zoomed in last week or so, we are trending down for about the week. But if you look at the big picture, COVID-like illness was still trending up. The case data, and I understand that there's facility outbreak situation in here as well, but the overall trend is up. I wouldn't put too much stock into the last 4 or 5, about a week or so, because that data takes a while, almost 7-8 days before all the labs report to us. That's just how it works. So overall trend is still up till proven otherwise. Death trend is up. It's somewhat flat, but it's still showing up on the trend line. And hospital capacity, again, if you zoom in, we've kind of flattened out on the top there. But if you look at the overall trend, the low was hit, mid-April, around April 13th, and then we've been, trending up for a while there, almost a month. We've been trending up. Now we're flattened out at the top. Does that mean we stay flat or come down? We'll just have to wait and see what happens. And the point that you were making, Your Honor, about hospital capacity, if you look at the last 8 or 10 days or so, we have come down in our utilization from a COVID disease standpoint. But overall, the trend still remains up from a low of around April, again, April 15th, 16th, or somewhere in that range. We were at 4% of cases that were COVID positive hospital occupied beds. And now we're at about 7% of that. And then for total bed capacity, we were at 2%, occupied beds with COVID-19 patients, and now we're at about 4%. So overall trend still remains up, but if you look at the recent last week or so, we're trending down. So there's sort of mixed news there. It's not all good, it's not all bad. But 2 weeks ago, we had mixed indicators. Last week when we talked, they were all pointing up, and now we're back to mixed indicators. So we're not, in the clear, but we're not, explosive outbreak either. So, just kind of wait and watch is currently the situation. Messaging doesn't really change. What people need to be doing is staying at home, and that's the best strategy. And the message has changed from, okay, you're ordered to stay at home, to stay at home when you can, because that is still the best tool. Social distancing is the best tool, and people really need to take that to heart. Everything else kind of comes later. When you're out in the public, wear a mask, because if you can't social distance, those situations do occur. So wearing a mask cut down on your risk and the risk of spreading it to others. And then seniors over 65 really need to try to minimize contact with other individuals and continue to stay home. And we did launch an educational campaign. I just wanted to kind of show those graphics. You all may have seen those, or people out in the public may have seen show up on their social media or through other avenues. And the messaging is pretty much what we've been talking about. Staying at home if you can, and then taking all the protective measures, washing your hands throughout the day, and taking extra precautions when you're out in the public. So with that, I'll open up for any other questions if you have any.
So, Vinny, as a part of this educational campaign, and I see that the examples that are in this presentation, that they're in English, but we have this also in Spanish and in Vietnamese?
Yes, that is correct.
Okay. And then just to make it really clear that if people are seeking an alternative language, that they can call the coronavirus hotline, and there are resources for a language line or staff that may be available to assist. Right?
Yes, okay. And that's part of our routine operations anyways. I mean, if people need other languages, we're more than happy to accommodate that. And I think I mentioned to you, even on a daily basis, we have some native speakers of Spanish or Vietnamese on our call lines. But if other languages are needed, we have access to the the language line translation service as well.
Okay, very good. So, and also as a part of this campaign, I'm assuming that this is all digital, but what else are we doing to get the word out about testing availability? I take issue with the fact that, the public is not interested. I think that that's true probably to a degree, right? And I don't have any empirical data. But I think that people waited so long to get a test that now that more testing is available, but still a very limited resource, that people have just given up on it. And we can't rely on any other entity to make it really clear to our constituents that if you need to be tested. So what are we doing in print? What are we doing snail mail? What are we doing digitally? You name it.
And I don't know that if I said it that way, I don't think that was what I was meant, that public lost interest, because that's not true.
No, but I've kind of heard that sentiment, and so I just want to make it really clear that I don't think that people are less interested. I think they probably just gave up on thinking that they could get a test.
Well, and I don't know if that's true, because if you look at overall testing data for Texas, I mean, we're increasing. I mean, and again, I haven't seen the latest numbers. I know the judge usually gets those on a weekly basis for Tarrant County. But, overall testing capacity and testing utilization is increasing. We were now, number 25, 26, and 27 on the opening of sites and so forth. There are many private entities that are also doing testing, and, there are several other options coming online. So testing is getting widespread. It's available. But the issue in our campaign that we started to, see was either time or location access. And that's limited to our stuff. I mean, that doesn't mean that there's no other options available. There are other options.
Sure.
But, your point is well heard. We've had a partner call with the Fort Worth and Arlington sites on Saturday on how can we work together to further advertise and ask people to utilize up this testing resource. So they're kind of brainstorming on that. We've been working with, of course, our PIOs and the social media team to try to get the word out. And then, of course, to y'all's offices. I mean, you guys help us out in that effort a lot by promoting this resource. And then finally, we've put the question back on our technology partners if they can help us identify any traffic trends. What we're finding is that, most of the referrals are coming from either our website or through the social media campaign. So that's one issue that we see. I mean, do we need to do print? Do we need to do radio? Some of our, educational campaigns do talk about messaging on the radio. They don't necessarily talk about testing. So that kind of stuff we're kind of trying to dive deep and see where we can improve and get more word out.
Great. And I want to make it really clear, and I think that this needs to be a part of this broader educational campaign, is that even regardless of where these testing sites are located, that the testing is open to any Tarrant County resident.
That is correct.
There has been
Yes.
some confusion, which I know we talked about that, but folks aren't necessarily just thinking, what county do I live in? They may just be kind of thinking at the city level. And of course, with respect to city, they would want to make sure that their residents know that this testing is available, but it needs to be crystal clear that we're a partner and that this is accessible for any Tarrant County resident, regardless of what city you live in. Which I know, of course, when people go to the website and if they qualify, they get a test, that the program could still send them to any location. But I think still on the front end, there's a really good opportunity that we don't want to miss in making it really clear that this is a resource for everyone in the county.
So, Vinny, when we had talked about people that go to our website and they actually qualify for a test, but then they choose not to have a test.
Sure.
And we were going to run some surveys. Have we
Yes,
gotten
sir.
any result back on that?
So we launched that survey actually last evening, and we've gotten about 65, 70 responses, and the main issue seems to be availability of appointment timing. And described earlier that it's giving the earliest available appointment so that operational sites can have efficiency, and people want more a choice of appointments, and that's we're going to look at that, see if that's doable.
So those are some of the things that we're trying to do to figure out. Even those people that qualify and know they can be tested, they simply choose not to be tested. It's not just that decision, but it's why are you making that decision?
Sure. Yeah. I mean, and Vinny, I know you spoke to that earlier. So I mean, I'm not saying that it's only our responsibility. Obviously, if someone gets an appointment, they should do everything they can to show up. But we have to realize that there are external factors, and some people have to work, and maybe that it's not an option for them to miss work to go get a test.
But if they're point where they qualify for a test, they are not be working probably.
Well, I mean, that's easy for
some
to say, but that's not
I
everyone's
understand
reality.
that, but do you want somebody working that's sick?
Of course not. No, I mean, that's not my point. My point is to make sure that everyone knows that the testing is available for Tarrant County residents. And to Vinny's point, if we're conducting the survey and we're seeing that these are the top few reasons why someone isn't showing up for a test even though they otherwise qualify, well, if our test sites are, and I don't know what the current windows are, but if they're only available from 10 to 2, then maybe there needs to be a discussion about, okay, well, for later this week, let's try from noon to 6 or from 3 to 7 or whatever. I mean, people work at any time, and there are people every day that are having to make the choice as to whether they go to work or not, whether they're sick or not. They had to do that before COVID. They're especially having to do it now. That's my point.
But in that case, if they're thinking about that and they're not wanting to miss work, then they're probably not going to go get tested because they're afraid they are going to come up positive, and then they would have to.
Right.
So one of the things
timing isn't going to make any difference.
It could.
So one of the things that we're doing, Commissioner, to answer one of the questions that you had, I had a call yesterday with the city manager of a fairly substantial city here in Tarrant County. They don't have a testing site in their municipality. And when we were talking, I asked him, I said, you do know that these sites that are fairly close to your city, that they're open for your citizens and anyone that lives in Tarrant County? And he wasn't necessarily aware of that. And so I think, full circle back, I think one of the things that we need to do is communicate with our managers to make sure that we use the cities to get the word out. I mean, it may be in the city right next to you, but you qualify, go sign up for it if you need to be tested. So we think we've covered everything, and then we find we have this big hole. So we're working to try to improve the accessibility and really the knowledge of people that they can go test at any of these sites.
And circling back to where we started this discussion, we ought to be testing people who are not sick.
Yes, sir. We're working on expanding that. I just feel very hesitant to open it up to the entire county, because if you just say, okay, anybody who wants to take that survey can get a test, whether you're sick or not, then might as well not do the website screening and just give appointments, because it's a resource issue, but it's also like when you qualify people based on their symptoms, we're finding 95% negative. What happens when you open it up to the entire public? I mean, there's just a lot of, and then that data does dilute, all the positivity data that we see, and then people make decisions based on that as well, So.
You ought to at least open it up to people who are members of high-risk groups. I am a member of several high-risk groups, and I bet you if I were to call that hotline or go to the website and try to get tested, I would not be approved for testing because I don't have any symptoms.
I will revisit that with the team, and that's a valid point. We'll make sure we take a look at that. Yes, sir.
Mary Louise, I think you had a question that you wanted to address.
So we all know we're coming back the 18th, and Vinny and I have worked on this. I'm going to look to the court and ask, and it started with Commissioner Brooks, can we have some type of campaign or educational protocol for our offices? In an instance, in a one-off, at a sub-courthouse, an elected official's employee, I believe, had the virus. It was communicated, but the other elected officials didn't find out. And then you have people upset, these are my people, and you didn't let me know, and I thought I made the right decision. Can we put something in place? Because we're bringing everybody back. We have separated everybody. We're opening the doors, commissioners, and some type of protocol, because it's very difficult to get a hold of him because he knows. I text and he's like, I'm busy. And I'm like, we need to have answers. And we're sitting around our senior table trying to be doctors. What does it mean? He made a statement saying if you're an essential employee, you're allowed to have a test. I'm just looking for a protocol. We have right now one of our very small departments. Her husband has all the symptoms. So what's the protocol? Do we send her home? Is she qualified as an essential employee to immediately go get a test? She's living with her husband. We believe. So what is the protocol? And that's what I'm looking for all of us, on behalf of all elected official departments. Put something out. If this happens, this happens. If this, rather than me trying to get a hold of him, and GK has been, involved in it, we're all guessing as doctors, and I don't think that's fair, especially after the 18th, and we're going to see employees starting to, my husband's infected. What happens to that employee? What happens to my department? And that's what I'm asking for.
Has she filled out a survey?
We found out yesterday at 4 o'clock. But my question is, does she qualify? I sent her home immediately, but do you see what I'm saying? Just can we, instead of us having that, can we have something
But
in
until
writing?
she fills out the survey, how are we, you're sitting there saying, does she qualify? Well, she hasn't taken the steps yet to determine whether she qualifies. And if she says no, then call Vinny and see what.
But you have all these department heads. Are we all, I have 170 employees. Any one up? I'm just asking for a little clarification. If you believe, just go to the survey and just send everybody there. That's fine. Just give us some direction. If that's your message, I will take it.
No, I just think that is a starting point. That's what we've been telling everybody. And that's what we tell all the public. That's what we tell everybody I come in contact with. Go to the website, take the survey. If it comes back and says you don't qualify and you still feel like you have some problems, then at that point in time, maybe talk with Vinny or talk with your doctor.
So I have a question. Her husband has all the symptoms. Would she go to this website and plug in information?
She should plug in information and then let me know what it says. So the way I understand it is that if you're a contact to a known case, you're qualified to get a test. And what we've been doing is trying to tell people, hey, just wait it out, because whether you get a test or not, you're going to have to wait the 14 days. So that part is true as well, because that was when testing was limited. Now that testing is available to the public and all that, that is not that big of a concern anymore.
Well, I would love to have that in writing.
I understand, Mary Louise, is you're just asking for just general guidance that can be sent out just as we would.
Sure.
That seems pretty simple.
We can do this.
Okay,
yes.
Great.
We can do that, and I'll get with the staff to put out some clarification guidance, because this is not the only department that has had that question. Others have too, so we'll just put out some FAQ and some guidance on that, and that will hopefully alleviate that. Any other questions?
Yeah, I have some questions on the if we go to the data dashboard, particularly the race and ethnicity portion. So we have 31% that shows not reported. Is that from the federal facility or in? I'm concerned about that it may skew off the other numbers, right? Because this time last week, the numbers for some of the other areas were larger. So how is that all connected?
So if you're looking at case characteristics, so that's aggregate data. That's all of the 3,800 or so cases.
Okay.
Yes.
So there's a percentage, this is 31% that's not reported.
Yes, that is a routine part of the effort. We try to capture that information. It doesn't come to us from the get-go. So it's part of their interview process on trying to capture that information and get that into our system. So that's why it's not there, because a lot of those are not yet done. It's a rolling process. As we complete interviews, we capture that information. Some people choose not to share, so a lot of that is considered, unknown or not answered. Okay, thank you.
Thank you, Vinny.
Court members, now at this point, we normally do the audience participation aspect before we get into any of the issues that are part of the COVID-19. So, Your Honor, do you want to do that now?
Yes, I believe I have.
What we could do, if you wanted to do our first item is simply the governor's declaration. Is that something that we want to do? And I don't think we have anything on that as far as audience participation. Do you want to talk about the comments of the governor? I think he had a May 7th declaration that he issued. I think it was GA 22. And then also we did receive a call yesterday from the governor's office. I believe that most of you might have been on that call as related to funding sources. And we were going to talk about that a little bit later on in the COVID-related discussions. But, Judge, we can wait on that.
Let's go ahead and do that first. Let's do these two things first, and then we'll take the calls.
Okay, so just let me get organized here for just a second. Okay, so let's just go over the executive order itself. And that was the one which was dated, as I said, May 7th, 2020. And this was the governor's executive order, GA 22. So basically what this executive order did, it dealt with hair salons, barbershops, nail salons, and other establishments where licensed cosmetologists or barbers practice their trade. So the governor moved back to an April 2nd deal and said retroactive to April 2nd, salons and businesses are now open for the public. And then, and also in that particular order, you might remember that the punishment of violation of an order at one point was a fine and also a potential jail time. And he changed that aspect of the order in that no one basically can be confined for violation of his orders. So that was the executive order that we saw last week. I believe that we've sent each of you a copy of that. So that's the executive order piece. When it came to the call yesterday, let me grab my sheet here real quick. This was really the disbursement of COVID-related funds, the CARE Act funds that had been sent to the state. And you've heard the judge talk about the 45-55 split and the fact that those 12 counties and 6 big cities received a portion of that, but not the entire 45%. And the remainder of the funds that were left over from that 45% was approximately $1.85 billion. And so the governor came yesterday and said that he was going to authorize the disbursement of those funds to governments that had not received a direct assignment from the federal government, such as the 6 big cities, nor those municipalities that resided in a county that received a direct assignment from the Treasury Department. And so I believe that there's 242 counties and a large number of cities that will get $55 per capita. But there was a stipulation to that in that only 20% of that money would be distributed immediately, and the remainder of that 80% per jurisdiction would be on a reimbursement basis, and would have to go through the Office of Emergency Management. So with that, there is still a significant amount of money that is being retained by the state, not just the 55%, but part of that 45%.
About $7.9 billion the state will retain even after they have distributed the $55 to the cities and counties in the 242 counties from that standpoint.
So what that means is that when it comes to those jurisdictions within Tarrant County, with the exclusion of the city of Fort Worth, they are not going to receive any type of additional funding from the state unless it's a reimbursement. They're not getting any piece of the $55 per capita. And there was a question asked by one or two of those cities, where do we go to get the money? And the answer was, you need to go talk to the county. And so when we get into the discussion, just after we take our calls, we're going to talk about one of the 4 pillars that we talked about last week, which was to ensure that our partners are made whole. And so we want to have a conversation with you about that $55 at that time.
And I'm not sure I wouldn't want to go ahead and have that discussion before we get on the call, because that may be a question that some of the folks have, and I'd like for us to, last week we began to earmark, or to at least preliminarily decide on amounts that would go to the various different categories. We talked about economic development in the form of grants. We talked about the social issues, which would be rent assistance, utility assistance, mortgage payments, as well as food and food bank type stuff. And then we also talked about testing and health related type deal. And I think, what Mr. Manius has said is we need to look at the cities and see what we can do with regards to that, knowing that we're working from just shy of $210 million is what the county itself received directly from the federal government.
So our 4 pillars that we talked about last week was, the first one was make our local partners whole. The second one was the testing aspect, to make sure that we could test as much as we possibly could. The social services aspect, which was rental, food, things such as that. And then the economic stimulus. And we put some numbers on the testing, the social services, and the economic stimulus. We talked a little bit about $20 million for the testing, $20 million for the social services and rental assistance, and about $30 million for the economic stimulus. If we go ahead and this is a decision of the Commissioner's Court, but if we go ahead and take the $55 per capita and assign that to the cities, then that would be somewhere between $64 and $65 million. And that would have to be, we'd have to make sure that if we did something like that, that it would have to be through an ILA, which is common practice. We would have to also make sure that everyone understood and well documented in that ILA that those expenses could only be those funds would only be allowed to cover COVID-related expenses. And we need to be very clear with our municipalities what we believe those expenses are. That if they do expend some of these funds for non-allowable expenses, then they're going to have to pay the county back, because the county is responsible for that money, because it's a direct allocation from Treasury. We all know that we have 41 cities in the county. We have some cities that are larger cities. We have some cities that are smaller towns. And we need to make sure that we can provide those smaller jurisdictions with assistance on how to, what's available, how to spend it, make sure you keep your receipts, turn those receipts in, those type of things. And I would suggest, since that is right in the swim lane of our community development program and the Mayor's Council that we have. I've talked with Patricia about this a little bit. We have the capability and the capacity right now to actually assist those smaller jurisdictions if that's the desire of the Commissioner's Court. And then finally, and I can't overemphasize this, we keep talking about the CARE Act funds, and we need to depend on Guidehouse to help us identify other funds for these municipalities to use also. Because while we think $65 million is a lot of money, they'll be spending the majority of those monies. And if there's additional federal revenue that we can bring to our cities and to the county, then we need to really strive to do that.
Are they going to be on the call today? Do we have them scheduled?
Not today. They wanted to talk to the entire court before they did that, so I believe they have a conference call with Commissioner Johnson this week. Next week they will be on the call on court today, and they will have input on this.
Well, I would like for them to be on each and every week. One of the things that I'd asked them to report on this week, it's my understanding that there is a tracking grant that we have to have applied for before May the 24th in order to qualify for it. And have we done that?
So we've asked, when we found out about that, contacted Public Health. Public Health has contacted Guidehouse. They've got the information. They're putting it together so we can make application.
And he's shaking his head. So we're going to have applied for that by...
Is that not accurate, what I just said?
Yes, sir, it is accurate. It's, the 24th is the deadline, and they're looking for a plan, so to speak, not necessarily a grant is what I understood. They just want to see a plan submission.
So the answer to that is that yes, we are working on that. Public Health is on top of that. We're following it. We're working directly with Guidehouse on that so that we don't miss out.
Beginning next week, though, they will be on every week to give us a report.
Right. It was not our choice not for them to be here. But we talked with them, and they said they would prefer to wait until they talked to all the court members. We said if that's what you prefer, that's fine. And then, but every week after that, you'll need to be on these court meetings.
Okay.
So when you mentioned tracking, did you mean tracing or did you mean tracking?
It is. It's basically it's my understanding it's taking the positive cases, tracking and trying to follow back up with with whom they may have come in contact. Is that it, or is it something else, Vinny?
Yes, sir. It's the contact tracing piece that we talked about. It's part of all of that.
Gotcha. Okay. Just making sure I understand. So, GK, you mentioned about community development's capacity and capability to assist our cities with are you talking about just the approximate 64 to 65 million aspect of it? You're not talking about everything else?
Not everything else.
Okay.
No.
Just
no.
Okay.
And that's typically something that the Mayor's Council, and which is community development, we do that type of work. We are going to be asking them to work with us also on the housing issue. And we're having a meeting after court today. And once we have that meeting, we'll be able to more fully flesh out what you all might want to do on that.
Our cities need to clearly understand that this money that they will perhaps be receiving from us is not to replace revenue that they have lost.
That's correct.
Because of the COVID emergency. It is not revenue replacement dollars. It's not to help them balance their budgets. This is to pay for additional COVID-related expenses that were not anticipated by the budgets that they passed.
That's correct. That's correct. So, Judge, help me along a little bit. Now, I wanted to talk a little bit more about the economic stimulus package, and then.
I know we were talking about around $30 million for that. We were also talking about I believe $20 million for the social, $20 million for health care, test related, and some of that. One of the things that in my conversation with Guidehouse that they indicated that we needed to be careful of is that if there was other monies that we could draw down from other departments, such as HUD or CDBG or some of those types of areas, FEMA, that we wanted to be sure and draw those dollars down and not use our CARE Act dollars, because it might be difficult for those to be used to reimburse CARE Act expenditures. I know that Commissioner Fickus has talked with a couple of counties that are a little bit further down the line on the economic. Williamson County was one that had, I believe, a very good application and grant type process. And I believe that Ms. Tidwell, is she over there?
Yes, sir.
Has also had an opportunity to look at that. So hopefully that may be something that as soon as we can get Guidehouse in and they can kind of okay or feel like we are heading in the right direction, that we could begin taking those applications and getting those funds available for distribution.
So, yeah, and I believe that Commissioner Fickus might be on the line. I was hoping that we might have a more detailed discussion about these processes next week, because we're gathering a lot of information, trying to make sure that we're all coordinated on this, so that when we begin to talk to you all, we can give you some options on viable programs that we might do.
Commissioner Fickus?
Yes, sir.
You have any comments you want to make?
Judge. Yeah, we have had some discussions with Williamson County, which is Georgetown. They're north of Austin, and they've got a program where they're doing $25 million. They're doing it pretty much in-house. They opened it up for applications last, I believe, Wednesday, and had somewhere around 1,800 applications, and they were supposed to be writing checks on Friday, and as far as we know, they were. So they're out, they're not going to write every check last Friday, but they're hoping to process a couple hundred applications a day. And they've got some partners that are working with them on it. But I know that Lisa McMillan has had extensive conversations with them. There is a software program I believe they're using, and I'm hoping that somebody has discussed that with them and talked to our IT department. But they've got a very simple application. It's strictly for small businesses under 100 employees, and limited to a maximum amount of $30,000. I think our goal was probably a little lower range, and maybe under 50 employees. So we were looking at, I think, more mom and pop and the real smaller businesses that really needed the help the most. So I know GK has been on top of this, and Lisa, so I want to thank them for the work they've done.
So you feel like that maybe by next week we can have a more in-depth discussion about this?
Yes.
Yeah, because we've reached out, we've talked to Williamson County, we've talked to our IT people. When we talked with them late yesterday afternoon about the software issue. It just takes a little while this is not a one-day setup type deal, but I think that we're moving really pretty well on this, and it attaches to that one of our pillars. This afternoon we're going to have this conversation about housing, and I think that you'll see that we've done a lot of research on it and have a plan. We'd like a rough plan for you guys to look at and give us some direction on. And that includes working with our partner cities. I have to tell you that our staff has been very aggressive on this, and we understand what the court said the last week, and that's what we want to accomplish. And you just give us a little time to get it all in place, and y'all are involved in it anyway, so we can make some decisions here. That's all we ask.
GK, is there a reason why we picked Williamson County versus any other? Is it just because they were further along in the process? I think I heard that, but I just want to make sure I understand.
So there's really two avenues counties are going. Actually, 3 avenues. Some counties are simply not doing any economic, we call economic stimulus.
Mm-hmm.
They're doling out their money to the cities, and they're doing some housing. Collin County is a good example of that, and they're pretty much understand how they're going to manage that. With as it relates to economic stimulus, you can go with a commercial company that will do that work for you, or you can try to bring it in house. I will tell you personally that I was leaning toward a commercial company to come in and help us with this, but there is a fee, and normally it's about 5% of total, and then some administrative costs also. Commissioner Fickus found Williamson County, and when we went and looked at their website and talked to their people, I really encourage you all to go look at that website. It's very interactive, it's very quick, and as Commissioner Fickus says, it's been very successful. And so we then turned to the county auditor, and because we would think that it would fit well if we ran this deal, that the analysis of the applications would be something that the county auditor would be doing, simply because the county auditor is independent of the commissioner's court, and I think that's important.
In terms of the economic stimulus aspects of this program, 3 things perhaps. Number 1, I'd like to see us address really, really small businesses, the moms and pops, who may not have but 2 or 3 employees, really, really small businesses. Businesses that did not meet the criteria for federal stimulus for either credit reasons or size reasons or bookkeeping reasons or whatever the reasons may have been. If they're in business and can prove they've been in business and need some help staying in business, they deserve some consideration from this program. And the other thing is that I want to make sure that disadvantaged and minority business enterprises have a real shot at getting some of the stimulus money as well. I think that's my 3 things.
Okay.
And I would just add, I have had some conversations with Mayor Price, especially regarding the definition. Where are we going to look at doing that? Fort Worth is basically saying, in order to be eligible for the funds that they received, the business will have to be in the city of Fort Worth. So I think as we're looking at it, we would be looking so as to basically say that the business had to be somewhere outside of the city of Fort Worth.
Yeah, that was our intent.
Yeah, that's our perspective.
Well, and I echo what Commissioner Brooks shared, in same with the judge. I would add that I think to ensure that it's an equitable process, that we need to, if we're doing it in-house, which I know we haven't made that final determination yet, but we need to consider even, I don't know if it would be a training program, but making sure that if people need assistance in completing whatever that application is, that we have the capability to do that, so that we don't leave out some of those businesses who maybe don't have the staff, or they're less astute and they can't just, maybe they don't call up their CPA to say, I need my books. So just want to make sure that we're making it as accessible as possible.
I think also as we're looking at the housing and rental assistance and things along that lines, I would, I think it's one thing to work with the cities as far as the economic maybe development part of it goes. But when it comes to the homeless and the food bank and the housing allowances, we've got organizations like Mission Arlington, like CEC, Six Stones, Grace, and a number of organizations, and they have become very experienced at especially identifying folks who may try to move from one group to another. And so again, as a not to reinvent the wheel, I hope that we'll work closely with those groups as we're looking to
that was our intent. If we talked a little bit about existing delivery systems, and if a system is out there we can utilize. A good example is the housing aspect in the city of Arlington. The city of Arlington has a large, well-organized housing assistance program. There's not a need for us to create something to go into Arlington. We can let Arlington do that particular work inside their city limits. They want to do that work. They've got experience delivering it into their city. So,
and while we've talked about giving them the $55 immediately, this will be extra money that we're putting into that community that will be, that Fort Worth is going to actually be taking that out of the $175 per person that they were allocated. Do we have any kind of, I know we're talking about on a 210, that means we had about 75 left over, but I know we've already spent. Do we have an idea at this point of how much money we have spent to date?
Yes, we do. So, Helen, do you want me to do this, or do you want to do this? For the hazard pay that we funded is about $4.7 million. The pandemic time off, PDTO, that's about 4.3. Other expenditures that we've made so far is about 4.9. That total is $13.9 million. The grant programs that public health has received outside of what we would apply to the CARE Act, they've received about $3 million. $3 million to go toward this. They have expended about $887,000 on that. And so none of this includes any of the workers' comp that we believe that we'll be incurring to a certain extent on this. So I think the thing that we need to make sure that you all know is that we're tracking these expenses. And that's a function of not only the budget office, but audit is right there with us, and payroll is too.
In that list of expenses you've got there,
Yes, sir.
Do you have the PPE that we have bought?
Yes, sir. That's the 4.9. I believe we've ordered a little over 2 million masks. 2 million masks and made distribution on that and other PPEs that we're using.
Helen is standing up.
Oh, you want to? If you're going to, come on up here. On the socialist.
That number that he gave you didn't just include PPEs. It also has to do with any of the air flushing that they're doing for the buildings that facilities is doing. So there's all expenses related to anything that's going on within the county is included in that expense line item.
That's okay. Yeah.
So we've spent about $12 million thus far, including the $3 million that we've been reimbursed from public health.
Our expenditure is about 14.8. 4.7, 4.3, 4.9, and 887.
But then we've gotten $3 million back.
Yeah, well, we in the public health department has received direct funding, not care funding, but direct funding to deal with COVID. And so that covers the 887,000 expenditure so far.
And that was from the state, if I remember.
It was from the feds, I believe.
The $3 million.
Sorry, the money came from the feds.
Yes, sir. It's a pass-through from the federal government via the state. Yes,
Yeah, okay, that's how it worked. So we are tracking those numbers. But like I said, for next week, we're going to have a much more detailed conversation about the rental programs and the food and the social programs, because we'll be talking with the two commissioners about that after court. We want to make sure we get with Commissioner Fickus. We're developing more information. Lisa and her group are doing a great job on the economic stimulus piece.
We kind of glossed over this point, but I think it deserves some emphasis, and that is that the social service money we spend, the economic stimulus money that we spend, the testing money that we spend,
yes, sir,
that benefits the residents of the 41 cities,
yes,
to whom we will also be dispersing dollars. So it won't just be that dollar amount that we write them a check for.
no, sir.
It will be the value of these other services that we are paying for on a countywide basis that will benefit the residents of their cities.
And you're exactly right, Commissioner. And one way that we look at it is when you look at the other 242 counties and those other municipalities, they're getting about $55. What our citizens are getting, our cities are getting that amount plus all of these other services on top.
The testing that we're doing, we're reimbursing Arlington for any of the costs associated with the testing out there at the parks?
That was our goal, yes.
Okay, and I just wanted to be sure, is that included in any of the numbers thus far?
None of those numbers, no.
But that could be paid for out of that $3 million that came to public health and would not necessarily have to come out of the cash.
Right. And yes, we keep coming back to this, and it's a good thing to do then. One of the things that we want to make sure that the court members know, our goal is to find different revenue streams, and the CARE Act to be the last source of funding. And so we're working very closely with Guidehouse on this. This is one of the major reasons why we asked them to come on board. And so if there's a possibility that we can fund these other things, then we'll fund them with other federal dollars. But at the end of the day, to at least staff is December 30th. The one thing that we want to do is to have this federal stimulus have the greatest impact on our county as we possibly can, and simply we want to spend every dime of it because that's what our citizens need.
So in these figures that we've come up with so far, obviously these are just a start, a ballpark, and as we work through these additional meetings and kind of adopting plans and recommendations, and we'll firm up those numbers.
Yes, sir. Yes, ma'am. And remember, we were not notified on the distribution. We didn't receive any money. It hadn't even been 3 weeks yet.
So before I guess, is our next step to move on to public comment?
Oh, yeah.
Okay. I have a question about the governor's orders, and then particularly the enforcement for salons and barber shops and things like that. Obviously, we have businesses that are unincorporated. What did our enforcement look like with businesses, any of those businesses in the unincorporated area? I hadn't heard anything, but I don't want to assume that wasn't an issue.
I'm sorry, would you ask? I didn't understand your question.
So the establishments that the governor had addressed in his order, where he made changes to the
salons and
right,
issues like that.
Yeah.
Yes.
Did we have any in the unincorporated area where we had taken enforcement now?
Not to my knowledge.
Okay.
Not to my knowledge. And so when you look at the population, just a factoid here, we have about almost 81,000 people who live in Tarrant County but do not live in any cities. So that's that population up there.
Yeah.
All those salons that now find out that they could have been open as of April the 2nd, do they have some way of recovering that lost revenue that they could have made since April the 2nd, except that the governor didn't tell them they could have been open from April the 2nd until 2 days ago?
Commissioner, I don't have an answer for that. I don't know.
I'd be looking for a class action attorney if I were them.
Not only give the surety, you can sue the state. Maybe
Yeah,
you can.
through the state, sure. State's the one that did it.
So we have a few more, but if you want to do audience participation first, then we have just one or two other issues on COVID.
And I guess we need to go ahead and make a motion to disperse to the cities the $55 per capita.
Yes, and remember, we're going to need to bring back an ILA for that also. I think what we would like for you to do is to make a general motion. I know the auditor is interested in this. Make a general motion that we set basically some guidelines or not guidelines, but parameters on the amount of money we might want to spend in some of these categories. That way, that will help the auditor as she goes through, trying to put everything in the different slots. So we don't know exactly what the amount is for the local partnership. We do know it's $55, so that could be part of it. We talked about putting $20 million into testing, $20 million into the social services and rentals, and the economic stimulus would be $30 million. When you add that up and look at how much we received, that still provides you with about $75 million. Then I believe our amount is going to be close to $40 million on our expenditures, so it still gives you some cushion that you can go back and hit hot spots, or if you see you need more monies in any of these. So if we could get a general motion that it's the Commissioner's Court intent to spend these type of monies in those four categories, we'll give you those categories.
I'll make that motion.
If we have a motion, I'll second it.
We've got a motion and a second. And
I would suggest before the court take any action on A1 and A2 that since we have the participation on those specific issues, you may want to take the audience participation first before this court makes any positive movement towards voting on it.
okay.
I do have a question though, right before that is, GK, you mentioned that $40 million, is that $40 million in addition to the 14.8 we've already spent, or is the 14.8 included in that 40?
I think the 14 is included. Well, remember there's $3 million sitting out there that's part of a different funding source.
Okay.
I'll tell you what, I think where we are, we have 210. We've talked about 65 for cities, 30 for economic development, 20 for social housing and food, 20 for tests. That comes to a total of 135 million. We've spent probably about 11. That would be about 145, 146. That would leave about 74 million. That is 64 million, excuse me. That would be kind of up in the air, or still there to cover hot spots, to cover additional, if we get into any of those other ones, though. I think social is probably going to need to be a little bit higher than 20 million.
That's why we're looking for, we want to have the reserve piece, but also remember that while we use this 209, go back to the guidehouse issue of trying to fund different revenue sources to pay for a lot of these programs. This is not to say this will come out of the CARE Act. This is just some ballpark numbers that we want to put together associated with these particular four pillars.
I think it gives each one of those areas, as you or as Patricia are talking with landlords, what they can say is, look, the court has said they're preliminarily going to set aside $20 million for this. They're serious about it.
Sure.
So when you come to the table, be serious with us, because we put some money aside for that deal.
Okay, very good.
So I'm going to make the phone calls now. Emma Jones is the first phone call I'm going to make.
Are we going to vote?
No, not until after we have the phone calls.
Okay.
Here we go. Emma, this is Judge Whitley, and you had put in a request to speak today at our court meeting. If you'll repeat your name and address, you have 3 minutes to make any comments you would like to make.
Thank you so much. My name is Emma Jones. I live in Fort Worth, and I am representing ISOT of Tarrant. Over the past several Tuesdays, many of our members have been making public comments during the weekly Commissioners Court meetings to urge you to end the county's 287G program, much like we did around the same time last year. Last year, you will recall that around this time, the Sheriff's Office gave a briefing where Sheriff Bill Wayburn claimed that the county was only spending an additional $1,800 annually on 287G enforcement, whereas other counties around the country have reported spending just over $500,000 to $1.3 million annually on this program. Many in attendance that day, including several of you, seemed not at all convinced by these claims of the sheriff. Fast forward to today, where we're battling a pandemic and ought to be doing everything in our power to protect residents of Tarrant County. Members of ISOT of Tarrant have previously called your attention to Washington County, Arkansas, where they suspended their 287G program in mid-April, citing the time and energy that they need to dedicate to the COVID-19 pandemic. They evaluated their situation, realized the pandemic and the public health crisis was the most pressing concern, and acted responsibly in ending the 287G program to free up resources. I can't help but think of that during our talk today, having accountability and oversight into what we're spending the CARES Act monies into. As Tarrant County continues to see COVID-19 positive cases increase day after day, much like Washington County, Tarrant County should be reevaluating its 287G program to determine whether it's a responsible use of resources during this pandemic. Based on the Sheriff's Office briefing on the matter last year, it doesn't appear that they can competently explain how much the program is costing the county, nor justify any benefit out of our participation in 287G. I would like to request that Sheriff Bill Wayburn give a briefing on the 287G expenses and the community impact in the coming weeks, so that the county leaders can make an informed, responsible decision on where we're dedicating our resources and how we can truly protect the people of Tarrant County, just as we are having this conversation about CARE Act funding and other funding for pandemic relief. Thank you so much for your time today. I appreciate the opportunity to speak, and I look forward to speaking with you guys next week.
Thank you, Emma. Next will be Diane Wood.
Hello?
Diane, this is Judge Whitley. You had asked to speak regarding the COVID-19 related to the nursing homes. Now, please give your name, and you have 3 minutes to comment.
My name's Diane Wood. I live at 813 Crawford Street in Fort Worth. I'm very impressed, and I appreciate very much the vast chore that it is to address all the various components of the coronavirus. Thank you for all the work that you do. I am an 82-year-old retired registered nurse. I have previous experience in public health and communicable disease interventions. I'm a mother, a mother-in-law, a grandmother, a great-grandmother, and I will actually die for any of my family members in a heartbeat. But they're not willing to die right now, and neither am I, whether in or out of a nursing home. But what I want to point out very briefly, and I know you already know this, but sometimes there's so much information. Sometimes there can be a way that we kind of get off balance. And I'm not saying you're off balance, but I want to comment about this. I've been watching day in and day out scientists all over the world. The way that we can stop the virus is one way right now, because we don't have a vaccine. And you know what those are. Testing, testing all over the whole county and everywhere, in group homes and prisons, wherever. Testing provides a lot of information, like where the virus is most prevalent, for example, and therefore some interactions, some interventions you might want to make in that particular area. It provides a lot of information. Never mind that 95%. I can't believe 95% were negative. But anyway, scientists say we must test everyone. And in order to prevent the virus, there needs to be 14 days of decreasing cases of the virus for 2 weeks. And not only the testing, but the contact tracing is extremely important, because you trace the people that person had contact with, and therefore you put them in, they're in quarantine. And therefore, those are the ways. All of these scientists say over and over, that's what we have to do to stop it. And we know what to do. The facts are, living in Fort Worth for 50 years, I know a lot about Fort Worth. The facts are, we have people in nursing homes that are not able to adhere to those restrictions. We have people in prisons. We have people in the federal prison. And by the way, it was a real comfort to me, Judge Whitley, to see your intervention and your careful determination to make sure that this gets addressed in that federal prison. So thank you for doing that. I would like for that to be extended to nursing homes, because we're going to experience it more. I mean, the public health director said, yes, it's gradually going up. It's going to go up a lot.
Diane, your 3 minutes are up, so please wrap up.
So I want to advocate that you do the same thing with the ICE detention center that you did with the federal prison, because this is a life and death situation. It's similar to if somebody had a bomb, circling Fort Worth. It's life and death. So people who live in Tarrant County work in that detention center. And so those are life and death situations. So communication, careful collaboration with ICE, with the federal agency, with whatever agency is administering these group homes or group facilities. That is what we have to do. We cannot ignore that. That whether it means releasing people or not. Releasing people in federal prisons, releasing people in jails. The sheriff's department continues to arrest and hold prisoners that are nonviolent prisoners, and so all of that has to be stopped. If it's not stopped, whatever we do is going to suffer. So that's what I want to say. Thank you.
Thank you. Have a good day. Next is Bruce Miller.
Hello?
Bruce, this is Judge Whitley. You had asked to speak today. Please repeat your name and your address, and then you have 3 minutes.
Thank you, Judge. My name is Bruce Miller. I live at 3932 Wayburn Drive, 76109 in Fort Worth. I'm a 78-year-old retired physics professor. I appreciate your taking an interest in what's going on in the prisons and the nursing homes, but please release the case numbers of the nursing homes, senior care centers, hospitals, and other hotspots so we can protect our own citizens. In reopening businesses now, we are not following the federal CDC guidelines, which recommends a 2-week period of declining cases before any action is taken. By not adhering to them, as modeling has both predicted and confirmed, we're risking recklessly the mounting infection or death. In some other states, when cases continue to rise after reopening, it was decided to pull back. Here, we're just reopening in the midst of increasing infection. So kindly provide us with detailed information on hotspots such as jails, prisons, nursing homes. It can be used so the citizens can intelligently guide our behavior. Thank you so much.
Thank you, Bruce. Have a good day. Next is Geraldine Cox. Geraldine, this is Judge Whitley. You had requested an opportunity to speak to the court.
Yes, Judge Whitley, I am pleased that you called. I'll hold on until you're finished with the last speaker.
Well, it's your turn now.
Okay, good. Am I on? All right. My name is Geraldine Cox. I live at 6212 Redington Drive, Fort Worth, 76132. I'm calling to express what is kind of like dismay over the fact that we seem to have so little ability to get a handle on solid data about things that are happening. That the prison data, the federal prison data of 400 and some inmates didn't show up in the count that we see online until Sunday. I look at the counts that are posted online as an indicator of how much danger we're in with respect to opening under Greg Abbott's new guidelines, and the fact that we don't really have much control because the waitress or the lady who owned the beauty salon from Colleyville got Abbott to open prematurely barbershops and beauty salons. All of a sudden, we're not on schedule with what Abbott had in planned, and willy-nilly, areas of enforcement go missing. So I'm asking you all on the Commissioner's Court and part of our last line of defense, if you would please be sure that we know and have some transparency about what's going on with respect to the 37% of the outbreaks in nursing homes in Tarrant County. As I read the statistics posted online about numbers of cases, I observe that in zip code 76133, which is just adjacent to where I live, there are 112 cases. In 76132, which is where I live, there are 27 cases. The problem is what's going on with the nursing home staff. How much protection are we getting from spread of diseases in the nursing homes to the rest of us in the community? They shop at the same stores where we shop. They go around in the world in the same places where we may start going. And we don't have any security that there is a control, a testing protocol, and sanitation procedures and solid procedures within the nursing homes to protect both the people who work there, the people who live there, and the rest of us from further spread of the disease in these identified hotspots.
Geraldine, your 3 minutes are up, so please begin to wrap up.
Well, that's it. Please do as well as you may. We would like more transparency. Presently, I cannot get the health department even to tell me which nursing homes have a high rate of disease. That's a matter of importance for friends who have family members that need to be put into some kind of extended care facilities. If one has a surgery, for me, if I have a hip replacement, I have to go into extended care facility because my dog, the only creature that lives at my house with me, isn't capable of taking care of me. So we need to know which nursing homes are dangerous, and presently we can't get that information from the health department. So those are my requests. Give us more information about what's going on, and give us more transparency. Thank you.
Thank you very much. Have a nice day. Next, Kathy wants to make a comment, but she doesn't want her address in the public record nor her phone number. And it says, what conditions have to be met before the county escalates/requests Governor Abbott to reverse the reopening phases? That would have to be a question with the governor. That is all I have with regards to the COVID. I have two other comments as it pertains to 287G, but we will conduct those at a later point. So with that, we have a motion on the floor, motion and second, that preliminarily sets aside $20 million for testing, $20 million for social services, $30 million for economic development, $65 million to the 40 cities, excluding Fort Worth, that have populations within Tarrant County. It also will reimburse the county for any current expenses that we have incurred, and will leave about $64 million yet to be segregated out for a specific issue. With that, there's no other discussion. Please vote. Commissioner Johnson?
Yes.
Commissioner Fickus?
Yes.
Motion passes unanimously.
Your Honor, could we go ahead and get the cities their checks pretty quickly, rather than as the governor is doing, giving them 20% now? And
we're going to go ahead. What I'm hoping is that by next Tuesday we'll have the interlocal agreements to I guess what we could say is an interlocal agreement to approve, and then upon request by the cities, or if we have the interlocal agreement ready to go, then we might ask them to fill out those interlocal agreements, submit those, and we'll approve those at our next Tuesday's meeting. And then the auditor will have the authority to go ahead and disperse those funds.
do we have an interlocal agreement written?
No, we don't, and we're going to need 40 of them because there needs to be an interlocal.
Yeah, but they all need to say the same thing.
Yes, they do. Yes, they do. So we'll work on that, and we'll try to bring you back as many as we possibly can by next week. Our goal is to get the money out as quickly as possible.
And I guess what we need is we need for them to apply for the $55, because there are certain things that they're going to have to. I mean, there may actually Reno.
So
I don't get that reference.
Well, Reno it's not Nevada.
Okay.
Reno has a few citizens within Tarrant County. Mm-hmm. They may not want to apply for their $55 per person. So I think that what we need is
we're going to go ahead and reach out to all the municipalities and begin conversations, talk to them about what this interlocal is going to be. It's going to be one interlocal that everyone has to sign. We're not going to have different language in any of these interlocals, and then we'll bring those back. But our goal is to get it out as quickly as possible.
And I think the Speaker of the House was kind enough to give us his estimates of all the cities' populations within Tarrant County.
We're going to get our own estimates.
Make sure that they're correct as
we'll
opposed to using his.
We'll work with COG to get the correct data.
Great.
Okay. So let's see where we are at. Okay. So if we can go to item number 2. One of the things that we've been working on is with the Texas Department of Emergency Management, the ability of the Texas National Guard to do pop-up sites for testing. And at first it looked like we weren't going to get one. And then with further conversations with with Mr. Roberts from Tatum. We were able to get one. And what this is a pop-up site where that they'll come on site to a particular location, stay for 1 day or 2 days, and then in the National Guard will be running the project, and then they'll move on. They'll take down their tents and then they'll move on. We believe that at first we thought they would be here every week. We believe it's going to be every couple of weeks they'll be here, but they may be here for more than 1 day at a time. And so we have scheduled one or they told us when the next one, the one would be here, and that's this coming Friday and Saturday. And so we got with Public Health, looked at the heat maps where we need to really have some of these. And while we'll be moving these around the county, our first one we want to put in the northeast part of the county and use our facility, which is located at 837 Brown Trail. Part of that building has been abandoned. The only thing that we need to provide for them is restroom facilities and maybe some cooling facilities for their staff. And so what I'm requesting is that you allow us to utilize the 837 Brown Trail Annex as a mobile testing site. And that testing site will be this coming Friday and Saturday, May 15th and 16th. The time periods for this is 10 o'clock to 6 o'clock. So they intend to try to test a maximum of 100 per day. And the only cost to the county on this is we're going to need some law enforcement out there for traffic control. So we'll be working with either the constable's office or the sheriff's department to see if we can get officers out there to do that. It'll be run by Texas National Guard and Tatum and the state. They bring all the supplies, they bring all the testers. All we have to do is provide the location, place for them to use facilities, and then also traffic control. And so this is our request. When we find out when the next next time they're going to be here, we're going to come back to court, get a different location from you all so that we can continue to move these mobile sites around the county.
So
move for approval.
I'll second the motion. So we have a motion and a second. Commissioner Allen?
So this is the National Guard site. Are they going to use their own screening tool, or are they using our website? And who is this open to? Is it for anyone, or just for Tarrant County residents? How's that going to work?
It is basically, is my understanding, it's open to anyone.
Okay.
But what they, according to Tatum, what they'd like to do, they've identified the four core counties, which is Tarrant, Dallas, Collin, and Denton. And they want to move those sites around that with this one because this initial program was for the rural areas of Texas, but we've got them to give us this. So they will not be using our site, but they have their own site. We will begin to publicize that site. They request we start 48 hours before. But what we're going to do is reach out to the cities in that general area so that if there's people that want to be tested, we can use those cities to advertise also.
And this would not change our capacity, so we're not going to make any changes to lessen appointment access for our sites, existing sites.
That's correct. This is an add-on.
Okay. Any other discussion? Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
So before we move on from testing, and I've talked about this quite often, is ensuring that we have access on the eastern side of the county. And so I know that Arlington is moving around the test site that's in Arlington, obviously that we're partners with. But I remain concerned about East Arlington, West Grand Prairie, West Central Grand Prairie, and a test site for 76010, which is one of the most impoverished zip codes in the county. So what's the timeline for making sure that we have more permanent testing for that area of our county?
So you're aware that Arlington is moving its site?
It did already.
And it's on the eastern part of Arlington.
Right.
And so what we're going to do, I talked to the city manager of Grand Prairie yesterday.
Okay.
And what we're going to do on that particular site, and also talked to Mr. Yelverton from Arlington several days ago, and we're going to try to communicate with those cities and have them reach out to their citizens to tell them, you need to go to this site if you want to be tested, and let them help be the voice out there for us to get people driven to that site.
Okay.
We'll never do enough advertising, but we're trying to cover it as much as we possibly can.
Sure. That only answers part of my question, though. When are we going to get a more permanent site for 76010?
I think that one of the things that we're looking at is that, remember our conversations with UNT Health Science Center?
Sure.
So they currently have 3 sites set up.
Right.
And it was their intent to set up a total of 5. So I think we need to continue to have conversations with Dr. Williams and his group out there to see if we can get one over to that part of the county.
Okay. I'd like for us to arrange a call or something tomorrow.
Be more than happy to.
Great. Okay. Thank you.
Judge, I think, do you have, we finished the vote, right?
Yep.
Sorry about that. Okay. All right, if we could go to item number 3. I want to talk to you just very briefly about employing project employees related to COVID-19. So as we go through several things, first of all, we're working with public health to come up with a major presentation. Hopefully we'll do that next week, and to identify resources and ask your permission to go out and employ additional employees. These will be project employees initially. But also, when we talk this afternoon, we're going to talk about the need for some additional employees as it relates to help us do the rental plan. Then also, we've talked a little bit about some of the things that we're doing with the economic stimulus. I think that our suggestion is that we do this in running 2 parallel paths. There's some municipalities that because of the virus that has impacted them, that they're having to do some layoffs. And I've already spoken with the city manager in Arlington, and those are government employees that are going to be laid off. They're management analyst level, which is a degreed employee that would be able to help do the analysis on some of these applications. We may be able to use them in other areas too, and some other cities may have the same issue. Our goal is twofold. One is to help our municipalities so they don't need to necessarily lay off people. We can contract directly for those services and bring those people as part of our work group. And then second of all, there are going to be issues where we're going to have to engage additional employees. And that's one reason why we have the COVID funding, is to shore up our capability and capacity to do work. And so you're going to see some of that next week. And I know when we talk about the housing issue today and the social service issues, we'll be talking about that also. I just want you all to be assured that we're looking at both tracks. We're looking at being able to bring people in from cities who might have to be laid off, and then also some other specialized areas we may have to ask you to assist us or give us the authority to employ project people for this issue.
So no action at this point.
No action, but I wanted to put it on your radar because no surprises.
Do we have an approximate number for Arlington that we would be able to utilize?
I've asked Mr. Yelverton to see if he could identify maybe up to 6 people. And I believe, Commissioner, you and I have had some conversation about that.
Yeah.
Okay.
No,
okay,
we have,
great.
for sure.
Okay, so now we're moving away from COVID. So we can go to item number 4 and number 5. I'm going to ask Ms. Camerino to come forward and make those 2 presentations.
Good morning.
Afternoon, Judge and Commissioners. Two requests for approval for letters of support from the North Central Texas Council of Government. The first one is support for a build grant application for the DFW Airport East-West Connector Project. That's a new location facility that will improve mobility on the southern side of DFW. There are additional details in your communication. If you have any questions, I'm happy to answer those.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Fickus? Commissioner Johnson?
Yes.
Commissioner Fickus?
Yes.
Motion passes unanimous. We got you. We got you.
Okay.
Wake up, Daryl. Don't start napping on us.
Oh, we're awake.
Go ahead.
Okay. The second is a request for approval of another letter of support for a build grant application, also by the North Central Texas Council of Governments. This is for the North Texas Moves program, which will improve the rail capacity and connections through the DFW region.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
And then finally, if we can go to item number 6, we're requesting that the Commissioners Court approve a letter of support for the joint mental health collaborative program grant application by MHMR to the Bureau of Justice Assistance. Just a quick comment on this. This is a 3-year program. It's up to $250,000 a year. The purpose is to provide wraparound services for people who have mental health issues that have been released from jail waiting a pending trial. If this grant goes through, there's going to be a requirement of a match that $73,000 for the first 2 years per year for the first 2 years, and $100,000 for the remaining year that the county will have to contribute toward.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Robert.
With that, we're going to take a short break.
So you got your fun category.
Okay, Ms. Tidwell.
We have 2 items we're asking the court to consider this morning. The first is asking the court to approve the release of $105,001,000 of collateral as outlined in your attached communication.
Move. Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
And our second item is we're asking the court to receive and file the quarterly investment report ended December 31st, 2019. And while this is for December 31st, I'll just update you through the current date. Obviously, the release of the collateral that you just approved was related to when we moved the funds into the local, to the pools, when it was clear that we could invest money. We have still $100 million approximately of the $210 at Chase, and the other $100 million is invested in the pools. The pools, as of 5/11, are paying 0.34 or 34 basis points, and the Chase checking, which is liquid, which is where all of the money will come out of when y'all start spending it next week and the following week, is invested at Chase, and it's at 20 basis points, just for your information.
So that's still 27. On average, I guess it's 0.27 basis points, or 27 basis points.
Move for approval.
Second.
A motion and a second to receive and file a quarterly investment report. Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Move to receive and file the personnel agenda.
Second.
We have a motion and a second to receive and file personnel agenda. Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Good afternoon. We have one additional item for the court. That's item 2. We're asking the court to consider approvals for approval of exceptions to the telecommuting policy. The court recalls that the policy was approved back on March 3rd. Generally, the policy requires that telecommuters be full-time exempt employees. However, the policy does allow for Commissioners Court to make exceptions, and that brings us to the request today. So we're requesting 2 exceptions, one for the Criminal Courts Administration Division. They currently have 4 substitute magistrates. These are the individuals who are involved in video conferencing at Green Bay and JPS. They are anticipating, of course, to have more locations in the future. These individuals currently perform these tasks at work and at home. So the exception that we're requesting would apply to current substitute magistrates as well as any future substitute magistrates. And so that's the first request. The second, a similar request is coming from Domestic Relations Office. They currently have 2 substitute caseworkers. These individuals are involved in custody evaluations and court services. Again, they're requesting an exception to allow these individuals to telecommute as well as any future substitute caseworkers. Questions?
Move approval for the sake of argument.
Second, for the sake of argument.
Well, let's argue.
I hope you don't want to argue with me.
Yeah. Why do we need to approve substitutes to work from home?
So Mr. Schubert is here for Criminal Courts Administration, and I'll ask him to step up. It's my understanding, though, as he comes, these individuals do have limited office space, and so currently, I don't know that there's the office space currently that would allow for all of them to work on site, and so. But again, I'll let Mr. Schubert elaborate.
Tina.
Yes.
Are the magistrates, the regular magistrates, are they exempt employees?
Yes.
So these are substitutes that work part-time. They do the same work. The regular magistrates, they can utilize the telecommuting policy because they're exempt employees. These are the substitutes for them. They don't work full-time. That's why we want them to have basically the same status as the regular full-time magistrates. Same way with the caseworkers as relates to domestic relations.
Okay.
That was it. And I think you said that, but it took a minute for it to sink in. So thanks again, GK.
Okay.
Did I answer?
Yeah, I don't have any additional questions.
I'm good.
All right.
Any other discussion? Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Thank you.
Thank you.
Motion passes unanimously.
So I'm going to do public health real quick. We have one item. We're requesting that the Commissioners Court approve a professional service agreement between Clinical Pathology Laboratories and Tarrant County on behalf of the Health Department as relates to COVID-19 laboratory testing. This is the cost of these tests are $70 per test. Just to refer back to the fiscal impact, remember we talked about this grant that Public Health got. That's where this is being funded out of.
Move approval.
Second.
We have a motion and a second. Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously. Commissioner Johnson, you have an interlocal agreement. I'll move approval.
Have these been approved by the DA? Have these been approved by the DA's office?
Yes, sir.
Commissioner.
Okay, I move approval of item 8I, 1, A, B, C, and D.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any appointments today? There being none, then you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second. Please vote. Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously. We have a couple of folks who want to talk with us about 287G. So I'm going to call them at this time. One is Jonathan Guterin.
This is Jonathan.
Hi, Jonathan. This is Judge Whitley. If you would please repeat your name and then make any comment. You've got 3 minutes to make comments.
Thank you. My name is Jonathan Guadian. I live in Fort Worth, Texas, 76119. Today I'd like to speak with the court once again regarding the 287G agreement in Tarrant County. As of May 10, 2020, there are 65 prisoners in Tarrant County Jail with active positive test confirmation for COVID-19 and 31 jailers with active positive test confirmation. While the active prisoner cases are finally dropping after almost a month since the first test confirmation, the number of jailers infected continues to rise every week. I am once again advocating today for the suspension of the 287G agreement in Tarrant County. Tarrant County must follow the lead of Washington County and Arkansas, which also suspend their 287G agreement to focus all of the resources and attention in the fight against COVID-19. 287G in Tarrant County is a racist program that as a coalition, ISAT of Tarrant has stated repeatedly, is creating a culture of fear among the undocumented community in Tarrant County in relation to local law enforcement. The 287G agreement is an expensive program that is costing the county an untold amount of tax dollars, which I must remind you that even the commissioners are unaware as to how much the program is costing our county, being as how Sheriff Wayborn has yet to reveal the actual cost of administering the program. Also, the agreement has not been proven to create a safer Tarrant County, which Sheriff Wayborn has also failed to provide data or information to prove this otherwise. Instead, the 287G program is diverting county resources and focus away from COVID-19, which is already proven to be worsening every week. Through programs such as the 287G agreement in Tarrant County, undocumented individuals are being funneled into ICE detention centers, which last week confirmed first death from COVID-19 related complication. Next month, when the agreement is up for renewal, the coalition ICE out of Tarrant and various other community leaders and groups in Tarrant County demand that the Commissioner's Court votes to suspend the program to concentrate all efforts in the fight against COVID-19 in Tarrant County. Thank you.
Thank you. Have a good day, sir.
You too.
Next is Henry Hillebrand. The neatest thing about this
Judge, on Mr. Hildebrand, I have comments.
Well, he does, but he also says he does wish to address the court, so I don't know if he's...
No, he just wants you to read what's in the... Just a comment.
Okay. No, she made comments about 287.
Oh,
This comment is from Henry Hillebrand. Thank you, Judge Whitley and members of the court, for administering to the needs of our proud county. Thank you for providing the time and space for me to submit my comment for your consideration. I trust you will consider the matters of my comment fairly and with the eye for what is best for Tarrant County as a whole. Last week, as a member of the ICE out of Tarrant County, I implored the court to view the 287G agreement as a hindrance to public safety, both with the relationship residents have with law enforcement as well as the added burden it puts upon the community given the circumstances of the COVID-19 pandemic. I would like to emphasize the second point further. It goes without saying that the hypervigilance of a program like 287G creates extra risk for all involved in its implementation. So too does its controversial adherence to the extreme enforcement policy. The spotlight on detention facilities is brighter than ever as a result. A federal judge in Bristol County, Massachusetts last week ruled that a detention facility participating in 287G was violating rights of detainees for not testing them for the virus. Tensions over the issue even boil over into a melee between staff and detainees. One can't help but wonder if it all could have been avoided if the cavalier enforcement of a volunteer agreement was never entered into at all. Would activists, the media, and a federal judge be looking into any of this if the agreement hadn't sparked the attention in the first place? Fortunately for our county, we have the opportunity to exit the agreement, avoid the liability of towing the federal government's extreme agenda. We know our county's resources are going to thin, and in the coming months, as our economy continues to suffer the effect of COVID-19, we can ill afford to toe that line and further burden our county's manpower, supplies, and time in courts for this measure. Tarrant County can avoid each such burden by simply working to protect the work of the public good as it did before we decided to pick up this albatross. Please consider such in your voting in the coming weeks. Again, I trust you will do what is best for the residents of Tarrant County. Thank you.
Your Honor, that's all we have at this time.
And we do have a closed session.
That's correct.
Then we'll recess our open meeting to proceed to close to discuss items exempted under Section 551.071, 072, 074, 076, and 087 of the Texas Government. Having returned from our closed session, there being no business to conduct at this time, we are adjourned.
The one thing